I would like to warmly welcome all of you today at the 9th progress report in the program. And besides the students and the supervisors, I would like to warmly welcome our international guests, actually from different universities from Slovakia, Ireland, who are visiting this program as well. So I always like to summarize just a little bit at the very beginning, actually why we are here at all. Because why do we need education and science, actually medicine? Because if you look at in the middle, the science and your daily healthcare providers, actually we are doing the daily program. If there is some healthcare challenges coming, you need to find a solution which the community will get benefits. Like during COVID-19, if there is a situation when you need a cardiorespiratory resuscitation, anything like obesity, cancer disease, you need to find some solutions. And what we found actually, that besides our medical work, there are two really big issues. One of them is the number of students or medical doctors interested in science are decreasing. And one of the consequences is that the healthcare professionals can drive the newest knowledge back to the patients. And I think the biggest hard evidence is the data of the European Statistical Office, which say that under 75, 1.2 million deaths could have been avoided if we use all the knowledge generated in the past in medicine. And especially in Eastern countries, it's 80%, 4 of 5 deaths, because the current knowledge is not delivered back to the community. And I think this is one of the major issues here, is to learn the methodologies, learn everything, how to drive the newest knowledge. And it's not surprising because 50 years ago, there were only 50,000 articles on PubMed annually. Last year, there were almost 2 million. So if you don't have a system, you can't bring this knowledge back. So our vision is very clear, science into healthcare, and our mission statement that we would like to achieve a breakthrough change in science, education, and medical training. This is the old model for translational medicine, everybody doing separately the different T values. However, the transition between the different T points are extremely slow, and therefore the transition of scientific knowledge for community benefits is decreased. I have the privilege of being a member of Academy of Europea, and last year or 2 years ago I was also elected to lead the clinical section of Academy of Europea, including 350 highly qualified clinicians and also 83 Nobel laureates. And we developed a program, a cycle program, in which healthcare professionals can do both medical training and scientific activities together, and they can bring this kind of knowledge back for the patient's benefits. And I think also, I don't need to introduce the journal named Nature Medicine. 2 years ago, they published actually the achievement of this program. And I asked at the very beginning why we are here, not to get a PhD, not to get an article. We are here to help our patients. And just 3 very quick examples. For example, a student from the Székesfehérvár Hospital joined to our program. After 1 year, learned all the methodologies, immediately could decrease the usage of antibiotics in pancreatitis with 31%. She could decrease actually the length of hospitalization of the patients for 1 day. Another very good example, the Heimpal Children's Hospital, where the current textbooks says that you need to test for diabetes, the CF kids, at the age of 10. However, every day new results coming up, so they immediately implied it, and now they are testing them after the age of 4. And they immediately could diagnose 30% of kids without any symptoms, and they could interfere their treatment. So before they had visual impairment or they had kidney disease, they could recognize these kids. So using the newest scientific knowledge going to patients' benefits. Or last year, Kata Illés and Tamás Horváth joined from the Bajcsi Hospital. They are otorhinopharyngologists. And concerning cholesteatoma, they looked at what kind of operational techniques would be the best. And they not only published papers in one of the most distinguished otorhinopharyngology journal, the Laryngoscope, but they immediately applied it in their hospital, and within a year they could decrease the recidive of the recurrence rate of cholesteatoma with 13%. So the biggest beneficial is not you guys, it's the patients you are treating every day. Concerning the academic part, this program was started at the University of Péter, and after it came to Budapest, 2 years ago, 91 students joined. This year, 83 students joined, and I am very pleased to let you know that this year there were 122 applicants. So we most probably will reach over 100 for the next year. And actually the program, and I will come back also at the end of today, showing that in year 1 you have the golden year, where you have 4 days out for your clinic to doing science. And next year this will be more difficult because you will have only 1 day for scientific activities. So within 2 years you need to fulfill the 2 first author papers. And the program is very structured. So the first 3 months, you drafted your PhD and you focused on what will be your studies. The next phase was the data collection. Now you will see how many data we will see because the statistics, the story making have been done. And the next part is to write your article and submit it. Next year you need to finish your second paper, and after you can defend your PhD. As we mentioned it, this program is not for those who don't want to go forward. This program is only for those who would like to progress. Therefore, every 3 months, you have to show where you are, and if your progress is not good enough, you go back to your hospital and continue full-time your clinical work. We started with 83 students, currently only 73 students in the program, so 10 students already stopped, and they went back to work in the clinic. I think this is a good news, because 73 could reach the day today. However, it's also a very good signature that if you don't do what is expected to do from you, of course you can't continue being inside the program. Currently there are 148 projects you are doing, and if you look at the second phase, the data collection, unfortunately this is a typical issue in Hungary or in many countries, especially Central Europe, where we don't have really structured databases in healthcare. So to get quality data, most of the studies will be meta-analysis. We already have international survey, registry analysis, and clinical trials. I would like to motivate all of you. We have a very good electronic system to build up actually your structured database, and it's free of charge for anybody who is inside the program. So if you build it up, this kind of distribution between the methodologies can change. This was at 6 months. About progress. Already there were 30 students completed the results, and this is now the 3 months development. There is already 1 paper published in a good journal. 7 articles are already submitted to journals, and 15 finished the manuscript. There are only a small amount of students who couldn't go forward actually in the program. As you know, we keep our innovation, so if you keep asking questions once, twice, 3 times, at the end of the day you will get a certificate, an excellent questionnaire, and not only this, but you will get a bottle of wine as usual. Yesterday we ran out of wines because almost everybody received a bottle of wine, so we went to Tesco and we bought the other bottles for you to catch it. Every year and every month we have the best students, groups, and so on. So the best student was this year, this month actually, Petrana Martinekova from the gastroenterology group. The best supervisor became Tibor Szarvas from the urology group. The best group became to be the gastroenterology group at that time. The best statistician was Bence Szabó. The best SMS became to be Fanny Mesnerich, and the best project students were Yael Hadani. We always have really excellent speakers. In the last 3 months, there were a Nobel laureate, Bruce Beitler, visited you and gave a fantastic presentation. He was the one who introduced the anti-TNF-alpha therapy, the biological therapy, very first time. And I think who heard Mark van Rast's presentation from Belgium could be very surprised about what kind of actions in COVID-19 disease. He was the leader of COVID-19 measures and science in Belgium, and had really excellent presentation. But somebody who missed it, you will be able to watch it online. And all of them who came said that the biggest benefits of this program is to have science and medical training actually together. We always have parties and other seminars. So for the last 3 months, I would like to introduce the tomorrow's Hawaii party, which will start at 6 o'clock at Füge Udvar. But next Monday, this will be the last lecture to come, and he will be Michael Wyshansky, who is one of the most prominent pediatric gastroenterologists in CF, publishing in New England Journal of Medicine, JAMA Lancet, and I think his journey about in research will be very good. This will be on next Monday, 1:30 exactly here. Of course, you also need to complete your credit points, and to get the credit points, of course, you need to come here. So this was the introduction about this program. I wish you all the best. I think all of you are prepared, but you have to show where you are currently. So, and I am very thankful for both who came to visit this program. So now I hand over for the chairman of the today, and I wish you actually a very good day today.